Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. As we continue to progress through spring, we're seeing our wastewater signals stabilize and continue to point towards a downward trend. This is a sign of better days to come, with a possibility for lower transmission through the summer. We're hearing many of our friends and family members, often the last of those who've not yet had COVID, or some getting it for the second time, who are getting sick with various degrees of symptoms and severity. These infections are what continue to be seen in our wastewater and continue to demonstrate to us that there are high levels of transmission relative to waves prior to Omicron. However, positivity rates are decreasing, and while our hospitals are still struggling with admissions from COVID-19, as well as severe non-COVID illness in emergency rooms and in their inpatient wards, there are optimistic signs there as well. It is important we continue to take COVID-19 symptoms seriously and stay home when you're not feeling well. The use of rapid tests can be helpful, and if you do have symptoms such as cough, fever, or decreased taste or smell, you should assume you have the virus and may be contagious. If you're using a rapid test, the Ontario Science Advisory Table says that you should swab the inside of your cheek, then your tongue and the back of your throat, and then your nostrils to make the test more accurate. If you perform only a nostril swab, you could miss the infection, as it's believed that the viral load of Omicron peaks later in the nose than it does in the throat. For instructions on what to do if you test positive or have symptoms, visit york.ca/COVID-19 positive. With this high level of COVID-19 still in our community, and with the fall on the horizon, it is still so very important to make sure you're up to date with your vaccines. If you were vaccinated earlier in 2021, and it's been several months since your last dose, your protection levels have waned or decreased. As people are gathering more frequently, the best way to continue to protect yourself against severe outcomes, hospitalization, or worse is to get your vaccine and booster doses right now, regardless of whether you've had COVID-19 disease. Fourth doses are now open to anyone age 60 or over and are particularly important for those at the higher end of this age group. If you're eligible, book your appointment right away by visiting york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. For anyone who still needs their first dose, second dose, or third dose, there's no time like the present. You can walk into any York Region public health clinic. As I mentioned earlier, we know that vaccine immunity does wane over time, usually within 3 to 5 months, especially for older individuals. Receiving your third and fourth doses are critical now to remain protected, especially for those who are older, immunocompromised, or at risk for many other reasons. Anyone 12 years of age or older should have 3 doses of vaccine at this time, and children aged 5 to 11 should have 2, especially with camp on the horizon. The weather continues to warm up, and with Victoria Day long weekend coming soon, we're looking forward to getting back together with family and friends. Socializing and gathering is so important for our mental well-being, especially following the past couple of difficult years. A few things to remember, though. Please stay home and consider testing if you're having any COVID-19 symptoms. Bring a mask with you in case you're finding yourself in the 3 C's, confined spaces, crowds, or in close contact, and feel free to wear a mask in any indoor space if you so choose. Be aware and respectful of the almost 15% of Ontarians who are immunocompromised or others who are at high risk. While COVID may seem over for many, for others it's a very real risk, and the fears are also very real. As you know, our local public health units, like York Region Public Health, have been focused on responding to the COVID-19 pandemic while still continuing much of our core public health work. But one of the areas we had to pause was the extremely important area of in-school grade 7 vaccinations for hepatitis B, meningococcal meningitis, and the human papillomavirus vaccine that protects against cervical cancer. We're now able to offer these vaccines to eligible youth who may be due or who may have missed their vaccines during the pandemic. School boards and families who are eligible have been notified with this reminder to catch up on these important immunizations, and we are available on Tuesdays and Wednesdays at our community clinics. We're hoping to create more availability soon. York Region Public Health is continuing to monitor COVID-19 and to plan for the summer and the fall and beyond. We're also continuing our work to prevent illness and promote health in so many other non-COVID areas. We're looking forward to working to reconnect with you and our communities in all of these areas and to partnering with you for a healthier future.